Want to welcome everyone to our Facebook Live event today. We're so just honored and pleased to have the Parkinson's Foundation sponsor this series of events during Corona. We've been on now multiple times, and the videos have been hit. The first video was almost immediately hit by 75,000 people, and so we know that during this time that is a lot of uncertainty and people are really worried about their families, their relatives, what to do. We want to come to you and answer your questions. And so that's what we're going to be doing today live. We're going to continue our Corona discussion. We discussed a little bit on the first Corona, just some basics about the coronavirus, and Fred Southwick joined us on that, and that's at the Parkinson's Foundation /coronavirus, all one word, and it's all this information is posted up there. A wonderful discussion with an infectious disease specialist, and really gives us this opportunity to interface, with the infectious disease experts, as well as to interface with the neurologists and the other medical professionals through this Facebook Live so we can see what everybody's thinking. And we transitioned last week or 2 weeks ago. We talked about cabin fever, and we answered a lot of questions for those of you that are stuck and are worried about your medical care and how you're going to get care and making sure with your medications and all of the many topics that come up, not just for people who are infected with corona, but when you have Parkinson's disease, you're affected because your doctor's office may be closed. You may be scared to go to the hospital, and it creates a lot of uncertainty. And during those times with uncertainty, that's the time where it can really eat you up inside. And so the Parkinson's Foundation is here to help you to deal with that and to help you through this. We have a 1-800 hotline that you can dial with your telephone, 1-800, the number 4 PD info, 1-800-4PD info. Feel free to call it. We've got nurses and healthcare professionals on at all times. If they can't answer your question, they'll call me. I'm not saying that I'll be able to answer it, but we certainly have worked together for many years on answering your questions online and Ask the Doctor and our online forums, which is another way that you can reach out, as well as now this hotline, which is really tremendous. So I want to shout out to John Lair, our CEO, and Leilani Pearl, and to Kathy Whitlock and Adolfo Diaz and their teams for helping to put this together. And we're going to focus today on hospitalization, but as we go to the live stream, I know that you all are caught and you have a lot of questions, and so we are going to answer your questions and try to help you in any way that we can. And so I thought this morning I would start out a bit here with a couple of show and tell things. That's why I'm sitting a little bit off center. I'm coming to you from the Norman Fixel studios here, proud to be in the brand new studio here at the University of Florida in Gainesville, Florida. And so I want to welcome, I'm seeing people that are joining from all over, from Denver, from the Midwest, from Kansas, from overseas, and of course people here from Florida, and we've had such a response to these, and so keep writing in. I can see your questions as they're coming in. I want to show and tell here for you. This is the Aware and Care Kit for Parkinson's disease, and you can see on here the 1-800-4PD info number and the website. This, by the way, guys, this is it. Ladies and guys, this is the number you can call where we've got health professionals available at all times to try to answer and help with your questions and concerns. And they're so experienced and so caring and so good. These kits that we formed have gone out to over 100,000. Let me say that again, over 100,000 patients. This is the hospitalization kit. Now, what this is if any of you have ever had a baby before, or maybe your spouse has had a baby, or your relative, you pack in those kits, you pack inside everything that you're going to need when you go to the hospital. Well, we do the same thing for our Parkinson patients. We've given out over 100,000 of these. It's awesome. It really was born from a series of actual research and clinical care projects among our centers of excellence. We have 47 centers of excellence all over the world, not just America. And you open the kit up and it has everything you need inside to survive, okay? And so this is super important. You can call our hotline, you can get online, you can order one. So if you end up going to the hospital during COVID or not during COVID, this could be, really helpful. And so make sure that you get your Aware and Care kit. Now, also, our nurses and our health professionals that run our hotline want to remind you that you can go to parkinson.org /letter, LETTER, to get the medication form, to get the letter that is in the kit that goes to your doctors and your nurses. And remember, they don't know what's going on. And so the idea of this Aware and Care kit is you're going to bring awareness to the people that are taking care of you in the hospital, and that's hopefully going to help reduce morbidity and side effects, and in some cases even mortality. We want to keep you safe while you're in that hospital setting. So you can go to your computer, you can type parkinson.org /letter, you can type parkinson.org /medform to get the medication forms. You can write out all of your medications, and so that they know. But one thing I will tell you that I've learned over the years is don't trust that things are going to happen just magically. Don't have magical thinking when you go to the hospital. I want you to understand that this is an unsafe place for Parkinson patients and that sometimes you have to go there. But we are here to try to keep you safe during that time, okay? And so let's talk today about hospitalizations, and I'm going to start with a beautiful quote that we have in our first book about 10 Secrets for a Happier Life. This is a quote by Jared Kinson. It's a very negative quote, and I apologize for starting negative, but I think it's so important that when we're talking about hospitalizations and Parkinson to start on this. Jared says, and I quote, "I have a favorite cemetery I go to because it's really clean and the doctors and the nurses are all very nice." Okay? I have a favorite cemetery I go to because it's really clean and the doctors and nurses are all very nice. And some of you are chuckling at home as you listen to this, and some of you are fearful and getting toward the edge of your chair. That's what I want to evoke when we talk about this today. This is a serious topic, and we want you to be as well educated as you can, because if we can get you educated, and that's why we have over 100,000 kits from the research that's gone on at the foundation out there. That's why we work with other foundations. We work with the NIH, with anybody that'll work with us to get the word out. We believe that we can save lives and improve your outcomes when it comes to hospitalization. So the other thing I'd like to do is start with a reading. We did this last week. I know you're caught at home, so we can have a little bit of fun online. And I've got the microphone here in the Fixel Institute, so I get to control what we do. And so this is the book here. Lead author is Ray Dorsey, that came out, called Ending Parkinson Disease. It's the prescription for action. And so many of you may have just seen that come out on the 17th. But in the book, it has a very nice section that describes something that I think everybody will enjoy. So this is from page 49, and this is a book written by Ray Dorsey, Todd Scherer, and Bastian Bloom, and myself. Even as its victims were being cared for, the pandemic continued in sweep. By the 1950s, polio was generating so much anxiety that people started staying away from gathering places that gave the virus more opportunity to spread. Does that sound familiar to everybody caught with cabin fever? Okay. Churches, swimming pools closed. In 1952, Americans feared polio more than anything except nuclear war. That year, polio had its worst outbreak in the United States, affecting 58,000 individuals, paralyzing 21,000, and killing 3,000. That year, the worst outbreak in the U.S. Those numbers are not even close to what we're seeing and what you're living through now. And so I can only imagine what everybody in your homes is going through. Treatment options were few. In the early stages of the disease, when muscles in the chest became paralyzed from iron lungs, which are giant metal cylinders in which patients had to lie down, assisted with breathing by regulating air pressure. At the height of the pandemic, dozens of children in iron lungs filled hospitals throughout the country. They spent day after day lying encased in these tubes with only their heads exposed. A mirror above their eyes allowed them to see more of their surroundings. After several weeks, most would recover enough to breathe on their own, but some people ended up relying on iron lungs for many years. Obviously, iron lungs were not the answer to polio. And today, obviously, the ventilators aren't the answer to the coronavirus pandemic, and hospitalization is not the answer to the Parkinson pandemic. Now, vaccines, which had recently become available for tetanus, diphtheria, pertussis, offered hope for a better solution, but to develop one, researchers first had to identify the cause of polio. They found that multiple strains of a polio virus were responsible for the disease, and with this information, Jonas Salk and Albert Sabin led efforts to make the first polio virus available. So I just wanted to give you a little bit of context of what was happening in 1952. We're in 2020 now, and everybody knows some about the polio story and the March of Dimes. And, you know, I think that we really want to put this into perspective, that we're dealing with a serious problem here, and that many people are going to the hospital. So that is a great lead-in for what we're going to discuss today. What we're talking about is hospitalization, and so I want you to send your questions in, and we're going to go through your questions, and we're going to answer them and try to address all the things that you need to know about hospitalization. And we'll tip in, and we're happy during this hour to hit a few other topics, but we're going to start with mainly the hospitalization type questions. So let's roll here. I've got the first question from Florida. The first question on my screen is, can my service dog come to the hospital with me? First of all, I can say that probably the best therapy that I've seen for my kids and my wife is we have a new puppy, and certainly that is an extremely good therapeutic when you have cabin fever. And we have at our hospital and in hospitals around the country certified dogs that can go in and help patients to relax them and to really provide that sense of comfort for patients in the hospital. In many hospitals, that has been under restriction, in terms of the people bringing in dogs that are part of this program. But I haven't seen limitations when you go to the hospital about actual service dogs coming in with you. It's probably worth a call to make sure, but I've never seen a patient turned away, and I'm watching all the screening every day when I go into the University of Florida Health, and they're doing a great job trying to make sure people can access their loved ones in creative ways and limit the spread of this disease. But I want to reassure you that in most areas and most zip codes that we're seeing, that service dogs can come to the hospital. So thank you for that question. The next question that I have up here, and thank you for asking the question, and I appreciate it. And oh my, you all are writing in, like crazy. So this is really, really terrific. And so I'm going to flip here to our next question, and I'm going to talk about coronavirus treatments conflicting with my Parkinson's disease medications. And actually from across the country and from different zip codes here, even outside of the United States, we're now seeing this question light up. And so let's take this one head on. Do the coronavirus treatments conflict with my Parkinson's disease medication? The answer is emphatically no. And the reason it's emphatically no is that the main treatment for coronavirus is supportive care. Okay? So that means we want to keep your lungs functioning as well as we can. So if you're fatigued, we don't want you obviously up and moving around too much. We want to keep you in your house, but we do want to keep you stretched out and stretching every day, making sure that you're moving a little bit to keep your lungs moving. We don't want to worsen the fatigue and worsen your oxygenation, but we certainly want to do the things that we can to keep you in your home. And then when you head to the hospital, again, it's going to be supportive care, isolation, making sure we're working on your breathing, helping you with all the other things to make sure your other medical conditions are stable. And then it's a lot of watchful waiting. Now, this leads into the question that is just lighting my screen up now and just lighting my email up. And this is the question about hydroxychloroquine. Okay, can you take hydroxychloroquine for Parkinson disease, and will it conflict with Parkinson disease medications, specifically things like Azilect, carbidopa, levodopa, rasagiline, MAO-B inhibitors, dissolvable selegiline, and those types of medications. And so coronavirus treatments in general, right now I would be probably irresponsible if I told you that coronavirus treatments that we know about, which are mainly preventative, will conflict with your Parkinson's disease medications, because it's mainly preventative and then supportive. You got to get fluids, you got to stay hydrated, you got to keep stretching, okay? But this idea of the hydroxychloroquine and Parkinson disease, will that affect with your medications? Well, let me just back up and tell you that hydroxychloroquine is a malarial drug. It's an anti-malarial drug. It's been used mostly for that particular indication. And when we do studies as scientists, a lot of times we're screening, we're screening information for drugs that might be effective against certain diseases or certain receptors. And what is very fascinating to me over the years are some of the same drugs keep showing up in multiple diseases, and then we go and we spend a lot of money and we test them and they don't work. And we've seen this with drugs like lithium. Lithium for different degenerative conditions is one good example. And we spent a lot of money exploring lithium. And we are seeing anti-malarial drugs come up. And anti-malarial drugs, they mess with a lot of different things, but the area that they mess with in lay terms are what are called ribonucleic acids, which are, that your genetics are from DNA, or deoxyribonucleic acid. RNA is how we make the proteins in your body out of that, and it messes with that. And the reason people are interested in this in corona, one of the reasons is it sort of messes with that, and they think maybe it could do something with the virus, maybe it could have a symptomatic effect. The bottom line is that when we look at the data, and the National Institutes of Health have looked at this data, Anthony Fauci has looked at this data and gone on record about this data, it's not very good. And in fact, all of the data that I've seen on anti-malarial drugs and degenerative diseases in general hasn't been good. And then the anti-malarial drugs on these viruses so far has not been, very good, a wash at best. And so I think we have to be very careful. These drugs have serious toxicities associated with them on your organ systems. And in fact, when people started to get excited about this, now we're coming up with toxicities. People are coming up with toxicities being on these. Some people are going to get better anyway, and so then they take the hydroxychloroquine. They may make it through some of the toxicity if they don't give themselves too much, and then they get better anyway, and then they say, oh, the hydroxychloroquine made me better. And actually, they might have actually gotten better faster without it. Who knows? But that's not the way for us to do the study. Most experts in the field, and almost all the experts, and I can say all the experts I've talked to, and all my friends are geek neurologists and neurosurgeons and neuroscientists and therapists that work on Parkinson. Nobody's excited about hydroxychloroquine. We've been down that road before. So I would say, will it conflict with your Parkinson medications? We don't know a lot about that because we haven't had people on the two together. I don't see anything right off the top based mechanistically, so that would just be a guess to answer this question that's lighting up. But emphatically, and I recommend no for this, and so do all 12 of the Parkinson disease specialists at the University of Florida. All 12 of the neurologists all recommend no on this, and all of the major specialists that I know. And so I can't tell people what to do, and those of you that have seen me as a patient know that my philosophy is I'm like your cabinet advisor. I've seen a lot of patients, and I've had the opportunity to share your lives and hear your stories, and I never tell people what to do. I try to just give you my best advice, and I never get mad at you if you don't do it. But there are significant dangers to hydroxychloroquine, and there's not a lot of evidence that it works. Now, let's say it did work for a certain segment of population of people with viruses, corona or something else. Let's just say that, because I'm sure some of you are like, well, I don't trust that guy. He's wearing this brownish suit. I don't trust guys in brown suits. So I would just say that, if there was a possibility that it worked, it's probably not going to work for everyone. It's probably going to work in lower dosages, or it might have to be an exact dose. And in order not to hurt and to help, any drug like hydroxychloroquine, fill in the Mad Lib with a different drug name. Maybe you're going to repurpose an anti-cancer drug, for example, or a blood pressure drug or a heart drug, and use it for coronavirus. Any of those things, if it did work, we would need to understand the basics of the dosing, the toxicity, at what stage you would give it. Because you could give it at a different stage of the disease at a certain number of days, it might actually make things worse. And people always say, oh, it can't make things worse, I'm just going to try it. Trust me, as a doctor that's given people stuff and made them worse, we can make you worse. Let me say that again. We can make you worse. And so a lot of times people are volunteering and thinking that that's not going to happen. And so I just want you to take in the full breadth of what I'm saying. If it does work and we discover it works, it would be better for us to save the doses for the people that it works in, understand the dose, and give those dosages at the appropriate time rather than use them up anyway. So from a public health standpoint, it doesn't make sense on all cylinders. And so I hate to be negative, because I know a lot of people want to have hope, but at this moment, I would just say try to be conservative on this question. But thank you for that question, and thank you for lighting up with it. We have questions here that are lighting up from different regions here. I was handed some questions too. The other one is about ibuprofen, okay? And we've addressed this a number of times here over the last few weeks. Let me give you the update. So people have taken ibuprofen that have COVID infections and coronavirus infections, and they take the ibuprofen, and what happens is some of those people get better and some of those people get worse. Some of the people that have gotten worse, and or have died around the world, have said, okay, well, what did they do? Because that's what we do, right? Like, we go back and we say, well, what happened? Like, why did this person do poorly? And a lot of the people that did poorly were on ibuprofen. That in no way means that ibuprofen was the reason that they did poorly. That's what's called an association. And so we have to be very careful with the associations. And so we looked at FDA guidance. FDA actually put out a statement. A friend of mine, Dwayne Thomas, who incidentally was the CEO of Charity Hospital during the disaster that happened with Katrina, and a really terrific leader and a mentor of mine. He actually put out that FDA guidance to make sure people understood that. And if you go into the language right now, there's no evidence that those two things are causally linked. Having said that, everybody is scared as hell about ibuprofen because of all the stories that are out there, whether it's debunked or BBC. And so a lot of people are taking Tylenol to keep the fevers down, because obviously, if you have a super high fever, you don't want the fever to stay up, and you want to get rid of that headache and the hallucination-like thing that you can get. We're starting to feel like you're dreaming or almost seeing things. And so in terms of what you can do, Tylenol, extra strength Tylenol, you can take Aleve or another type of NSAID, naproxen sodium, if you're worried about it. But to be honest with you, the experts in Parkinson disease that I talk to, nobody's worried about it. But there are alternatives: Tylenol, naproxen sodium, other things, if you're totally worried about that one. So thank you for that question. It's lighting up from all over, and I think it's cool. And as you guys write your questions, it's really fun to see where you're coming from. Whether I'm looking at people from North Dakota and seeing people from Brazil and overseas, and here's a message, somebody from Boston, and I know you're really hurting in the New York and Boston region. And so Marilyn writes from Boston. Hi from Boston. Your new book's great. The sheet on the Parkinson Foundation website about PD hospitalization for COVID is really helpful as an adjunct to the kit. So folks with DBS might want that added to the sheet. Thanks for your down-to-earth communication. So thank you, Marilyn. And I'm going to point you back here because Ann Wallace, if anybody's ever called the helpline, gotten Ann Wallace, she's awesome. Sharon Metz and all the people that are on that helpline are awesome. So Ann again said you can get the coronavirus letter by going to org/letter, and the medication forms as well, /medform. And I'm sure you can type into Google Parkinson's Foundation hospitalization and hospitalization kits and let that search engine take you. But what Marilyn is telling you is that in addition to this, so those of you that came on late, get your free kits, by going on the website or talking to one of us. If you have to go to the hospital, you want to bring this kit with you, the Aware and Care kit. It could save your life or save you having side effects. But in addition to that, some of the things that are now available and downloadable from the website seem to be a good supplement. So thank you, Boston. Thank you, Maryland. We certainly appreciate that. So moving down here for the questions, and I'm just blown away by how many great questions are coming in. Here's a question about a Parkinson's disease hospital bag that came in prior to the show here, and it's that I'm concerned if I'll get my medications given on time every time. That's a reasonable concern when we go in the hospital, and that is probably the number one thing that we're concerned about when people go to the hospital. And then they say, now especially during COVID, if my family's not allowed to be with me and to advocate for me. So this is really just a great point and a great point of discussion. So we have a lot of Parkinson patients, right? So let's say you need to go to the hospital for COVID-related reasons or unrelated, or you're not sure what. Could be heart, lung, whatever. But let's say you end up in the emergency room of the hospital. We hope that you don't, okay? And let's say they separate you from your family for your safety, for the safety of the people that are taking care of you, which is tragic. This separation of families for the safety and the spread of this virus is just tragic. But let's say that those two things happen. Well, one of the things that we have learned over time is that if you ask the doctors and the nurses to rewrite your medication schedule and rewrite an order that says, let me take my own pills and my own bottle. A lot of times you can give the pills and the bottle to the nurse. They'll take them to the pharmacy, and the pharmacy will certify. Okay, they will certify that and allow you to take your own pills and write an order to let that happen. And in cases where people are cognitively okay, they're thinking okay, or they don't have a breathing tube, or there's a family member at their side that can help to do this, that can be a way that you can get the pills on time every time. Now in the COVID, that's why this is just such a great question that comes in from North Palm Beach, Florida, from Linda. Such a great question because, okay, now you may take away that helper that you have that's making sure things happen, so now you're out of balance. What are you going to do now that you're out of balance? So I think the answer there, the thing that we really want to focus on is go back to your Aware and Care kit. Okay, inside the Aware and Care kit, or if you're at the hospital, you don't have a kit, you can download the information off of it. And you want to teach the nurses and the doctors about all the things they can do to keep you safe. So it's up to you to become the advocate here, okay? Because it turns out, I know that it's terrible to say, but it really turns out that they may not know how to take care of a Parkinson patient. You think they would, but I guarantee you they don't spend a day in nursing school, in most nursing schools around the world, not just around the United States, talking about the care of Parkinson patients, right? So you might be the person that just has to teach them. It's not that they're incapable of it. So we know that 1 out of every 4, our research at Parkinson Foundation shows us that 1 out of every 4 patients that go to the hospital, okay, with Parkinson's disease, 1 out of every 4 times you don't get your medications on time every time, okay? 1 out of every 4 people going to the hospital are not going to get their medications on time every time. And actually, let me check that statistic to make sure that that is updated on that, because I think that statistic may have changed here over time, and it may be now 3 out of 4. So I'm just going to check that for you here as we're going along. So we know that the number of patients here, it's actually 3 out of 4 patients now. So we went into this project a number of years ago, and we thought, okay, well, we have people that are in the hospital and they're not getting their medications on time. So we figured maybe 20-25% of the time this is happening, right? Well, let me tell you, Parkinson Foundation researchers went in, I'm looking at the study right here, right now, and 3 out of every 4 people don't get their Parkinson medications on time every time. 75%. Wow. Okay, so you need to be the advocate. So Linda, back in North Palm Beach, you've got to be the advocate to make sure. The other trick, okay, I'm going to give you a trick here, is you teach your doctor how to write an order, right? Do it in a nice way, because a lot of doctors have a lot of ego. You know, I can tell you, being a doctor, and so you got to approach them a little bit, and you know, make them think that they're important and that you respect them, and show them that level of respect. You know, but say something to them like, hey, you're doing an awesome job taking care of me. I have this Aware and Care kit, or I heard about this Aware and Care kit, and Parkinson Foundation says 3 out of every 4 patients don't get their meds on time every time. And I don't have my spouse or care partner or family member here to help. So could you possibly rewrite my orders for my medications so that it has the exact time and the exact number of pills? So instead of saying 3 times a day, I want to get it at 8, 12, 5. Instead of saying every 2 hours, I want to get 2 pills at 8, 2 pills at 10, 2 pills at 12. This is super important. And even if the nurses can't do it exactly, they're going to get a lot closer than 3 times a day, 4 times a day, 8 times a day, which is the easy way to enter it in the computer. So if you can cajole, if you can, you know, sort of work your way into the doctor's head and get them to rewrite that order in that way, that can change things. Because usually when you do that, the nurses can't be perfect because they usually have multiple patients that they're caring for at once. They're going to get a lot closer. Okay, and so that's a little tip, a little pearl that you can take home and use. So thank you so much for that question. So on the line here, the information specialists are Kathy is giving us information here about reaching out to our helpline for referrals to our healthcare professionals. Thank you, Kathy, for giving us that information. 1-800-4PD-INFO. That's 1-800-473-4636. And also she's provided the website links as well. You can see within the chat, and that can be really, really useful. So thank you, Kathy, for that up for everybody. It's I think super important. So the Joanne Prentice writes to us, and thank you, Joanne. Says, as a hospice nurse, I'm laughing out loud. Thank you, Joanne. At least I get a laugh. I'm here by myself in the studios because I'm in social isolation. Remember, weeks and weeks ago, Fred Southwick and I were breaking the rules as an infectious disease and neurologist as this COVID thing was getting together, I think on the 24th. And we're now, everybody's socially distanced, the building's empty. And so I get to laugh out loud by myself, but about helping to teach MDs how to rewrite prescriptions so the doses are included. Thank you. I did that the last time my husband was in the hospital a while back. So thank you so much, Joni Prentice. I'm sorry, it's not Jones, Joni Prentice. Really want to shout out to you. Now, Zhao Qi has a post here about the polio vaccine. Remember, we started with a reading about that, and we're also very interested about developing vaccines for treatment of corona. They're going to be at least a year away because the trials are going to take that long. So we've got to focus on prevention now. We can't depend on the vaccine. But we see this question from Zhao Qi. When the polio vaccine was first released, it was contaminated with SV40, a virus that causes cancer in monkeys, and people could have gotten cancer from it. The USA has taken liability from vaccine manufacturers. If you can get hurt or damaged by a vaccine, you have to sue the federal government, and there's a link here on that. So thank you for that. I mean, I think we're getting into an age here where we're going to have to start thinking about it. Now, we recommend, also talking about preventing hospitalizations, we recommend that all of your health care, when you're seeking it, that you are advocating to get a flu shot every year, to get a pneumovax shot. Remember, the flu shot is for the viral flu, and they try to predict which flu it's going to be. And hopefully that flu shot's going to be paired up with a coronavirus shot here in 2021. We don't anticipate that coming before 2021. It'd be great if it did. So we're in prevention stages now. And then for pneumonias, it's a bacterial type of organism. So there's viruses and there's bacteria. And so Fred Southwick and I talked about those differences a little bit. And so you can also protect yourself against bacteria with something called the Pneumovax for common bacteria. That can also keep you out of the hospitalization. And so I think that's super important. And thank you again for the history. I thought it was really telling when we were looking here at, I think Ray Dorsey wrote that section of the book in Ending Parkinson Disease. He wrote about the number of patients and how catastrophic it was in polio. And it's way under 100,000 patients in 1952. And look at the numbers that we're seeing on the screens every day, just growing and growing and getting over 1 million. We have a real pandemic on our hands. And so I'm really sorry for everybody that has Parkinson that's caught at home. We want to try to keep you out of the hospital. So that's what we're talking about. And then if you end up going to the hospital, we can help you. You can even call our nurses on our helpline, get our Wear and Care kits, these kits here, for those of you that are on here. They can be super helpful. So Stephen in the United Kingdom, welcome Stephen. Thank you for your question. He wants to know, considering that there are many stages of the Parkinson condition, will all be included as high risk, and who decides who's high risk? Okay, this is really important. We go over this as much as we can. So let me explain risk to you. The best that we can understand about the coronavirus, Stephen, is that the Parkinson patients have roughly the same risk of getting it as people without Parkinson, okay? Roughly the same risk. Immune system is roughly working pretty well in Parkinson disease compared to other diseases where we say people are immunosuppressed. Now, interestingly, some of the research shows us differences in the immune system. So people like Malu Tanzi and Richard Smaney and David Standard, look at these immune things, and there's lots of researchers that are looking at really cool things, David Sulzer at Columbia, but fundamentally the immune system works pretty good. So the risk has nothing to do with risk to get it. You still need to socially isolate, and you need to keep yourself separated. But once you get it, Parkinson represents a high-risk category, whether you're younger or whether you're older. We know that the lungs don't work quite as well in Parkinson disease. We know that at different people with different Parkinsons, they can have symptoms, but they are at higher risk. So you, if you have Parkinson disease, or your spouse, or someone has it, they're at higher risk for pneumonias. They're at higher risk for other complications that it's going to make it more difficult for them to recover. So here's the bottom line. Risk to get the virus, probably about the same. We might find out after we get the data that it's slightly higher. If it's going to be higher, it's probably going to be slightly higher in Parkinson, but very close, okay? We'll call it a draw, If we were in Vegas, we'd call it a push, right? So about the same risk. But for those people, whether you're young onset Parkinson or older Parkinson, once you get coronavirus or influenza, or one of the things that the Pneumovax protects against, one of those bacteria, you're at higher risk to recover. And so I hope that that's clear, and that's what we're talking about when we're talking about high risk. And then when people say we're going to stratify you as high risk or not, that's what they're talking about. That's why in our practice here, we've converted everyone over to telemedicine. So we're seeing people by phone and by telemedicine. We still see people in person when we need to, but during this crisis, we're trying to keep people away from us and away from each other, and we're trying to stay isolated as much as possible. We need to keep our healthcare workers healthy, and we need to keep you healthy. So one of the top things that you can do to prevent coronavirus and prevent going to the hospital is cabin fever. You want to get cabin fever and not corona fever. And what do I mean by that? I mean, you stay in your house now, you batten down the hatches, let the delivery people come, leave your groceries, leave things, use different services. I don't favor one against another. I've heard patients write in and say they use Amazon, Instacart, Whole Foods, Publix, whatever supermarket you have. Get things delivered to your door if you need supplies, if possible. Try not to go out. If you do go out, take walks, stay away from people, and really isolate yourself as much as possible. And now there's a new recommendation from the Centers for Disease Control that when in public, you should wear some sort of covering over your mouth, scarf, or if you happen to have a mask. We've been trying to preserve masks, for the protective gear for our hospital workers, but we're getting more and more masks. I just got a donation from a patient of several thousand masks here. The same patient just gave a donation of 300,000 masks to New York City. So we're trying to share as much as we can, but these are things that you can do to try to prevent getting the coronavirus. And then once you have it, that's why we want you not to get it. We want you to stay home. We want you to socially isolate. We want you to, it's respiratory. We want you to not come in contact with people. Don't let your relatives in. Don't let people in if you don't have to. If you use the caregivers, use the same caregivers. And if you have different caregivers, you've got to talk to those caregivers about making sure they're coming and going and staying isolated themselves, because they can be a vector. A vector means they can carry the virus to you. And so those are the main things that we are thinking about. So on prevention of hospitalization. So I have another question from Nick in Atlanta. So shout out to Atlanta. I know you guys have a pretty good soccer club there that you're proud of. So a shout out to Atlanta. And Nick asks a really good question. He talks about the guidance. I'm going to paraphrase a little bit. Talks about the guidance from the Washington State Health Department about when to consider transferring patients out of the hospital to palliative care settings, and these decisions about who lives and who dies. And he wants to know, because in Parkinson's disease, when you experience an off, when your medications wear off, you're stiff, you're slow, you're tremulous, you may not look so hot when you're off compared to when you're on. And so he's worried that people are going to look at Parkinson's and they're going to make those decisions when people are at their low point, either with COVID and with Parkinson together, and that people with Parkinson are going to get pushed into this category where they won't get as much care, and maybe if there's a choice for a ventilator, it's going to go to someone else. So Nick, thank you for this question. This is really important. We have many neuroethicists and ethicists that are looking at this, and you've probably read some or at least heard about it, or you've thought about it, because no one wants to be put in the corner and told, okay, we've got to take care of younger people. So the key here is resource allocation. And I would have said that a couple of weeks ago, we were closer to getting to these types of discussions, with patients. And we're starting to get in a better position, a stronger position, so we have to worry about this less. Because of these ships that are coming to come next to these large urban areas like New York City and LA that are getting a lot of cases, because we're moving ventilators. We're using the supply chain of the United States from different states, and we're moving almost in a rapid response fashion to where we need to have the assets on the ground for patients. And so the hope is that we won't get to that point, where we're having to make these decisions. Some of these hospitals in New York City, frankly, if you listen to the doctors and the healthcare workers, they feel they've either reached that point at certain times during this crisis or exceeded it. Okay? And so, Nick, thank you for your question. This is super scary. So we've got to do a better job of putting the resources in place and being able to move them. And so shipments of ventilators from other countries like China or other places, shipments of protective gear, making sure that we can move doctors and nurses from one state to another across all of these restrictions that are going on, so we can rapidly respond in the hot spots, is going to be part of the solution. And I have to say that I was very worried, Nick, about your question several weeks ago, but each day that goes by, I'm becoming a little bit more comfortable, at least on the United States front, that we're doing a better job so we don't get into those decisions. Once you get to those decisions, all bets are off, because it really, I think one of the doctors that was interviewed said this well, it really comes down to the doctor that's in front of you at that time, making these decisions in real time. And the doctors, they don't want to have to make this decision. I don't want to have to make that kind of wartime triage decision, so it's super important. Nick and everybody else on, I'm also going to say there's a wonderful article in the New Yorker this week, and it features a neuro ICU doctor, a neurologist ICU doctor, named Human Kamal, who is a good friend who works in New York at Columbia University, and he runs their neurointensive care unit, which has turned into a COVID unit. And he's interviewed, and he has a young baby and his wife, his family, and the things that are going on in the hospital. If you want to get a sense of like what it even feels like through the eyes of a neurologist in a hospital, this is a wonderful interview in the New Yorker, and so I would recommend you take a look at that. So thank you so much, Nick. Here's another question, and I'm seeing this question actually light up on my screen, okay? And I'm going to directly address this question because I know that lots of people are worried about this in the Midwest and in the West and in other countries. And so the question, from everyone is, hey, Dr. Okun, you're a Parkinson specialist. Do you have any Parkinson patients with COVID? And are they surviving, and how are they doing? So I'm happy to report that in our practice here at UF Health, we follow a lot of patients, some of whom have COVID and have Parkinson disease, and so far we're keeping people in their homes, and we've been, knock on wood, doing well, and everybody is surviving, and I've even had some people recover already. And so the first message that I want to send out is that it's not a death sentence if you get COVID and Parkinson disease, okay? We got to do all the right things, and it's still not an automatic that we want you to go to the hospital. And we're talking about hospitalization today. That's the overall topic that we started on. And so we always say in Parkinson we can save lives if we keep people out of the hospital, right? Remember, we used to think maybe 1 or 2 out of every 4 people weren't getting their meds on time every time. It's 3 out of every 4. Then people get the wrong meds. So people get confused with Parkinson, and then they give them these meds that block dopamine. And everybody knows how important dopamine is. If you block dopamine, you can have an extra few days or an extra few weeks in the hospital for a single dose of those medicines. And we know that through Parkinson Foundation research. And so here's the message to all of you that are lighting up on this question. And I've received copies of many of the questions coming into the studio this morning. You can survive this with Parkinson and COVID. We have seen it. We're doing quite well here in our practice at University of Florida. So I want to express a sense of hope and a sense of optimism. But we don't want you to get COVID. So stay home, okay? Cover your mouths. Keep isolated. Cabin fever here for the next month or more until we can re-advise as to what to do now more than ever. And I told you I try to act like a cabinet advisor to my Parkinson disease patients, meaning that I try never to tell them what to do, okay? And but when it comes to COVID, I've actually crossed over and I've become a little more paternalistic. And when I call and talk to my patients, and I've called a lot of people, and in between running the crisis management here institutionally and clearing beds and making sure that we're ready for the response and we can help all over the state because this is a safety net hospital. In between those things, I'm trying to talk to as many people as I can, and I'm trying to express, my seriousness about like staying home and socially isolating. That it's a respiratory bug, and it's doubly bad if you get Parkinson with this. And so we will take care of you. We can help you to get through it. But it can cause more complications if you have Parkinson disease. There's no telling what will happen if you get COVID, even if you're a young person or an elderly person. But thank you for these questions because people are definitely surviving it. I'm seeing it with my own eyes. But it's a bad bug, and it's one that can cause a lot of morbidity and in some cases mortality. We're trying to keep people off ventilators. We're trying to keep people at home. Now here's another question. So I'm in the hospital. And which of course I hope isn't the case, but so I'm seeing this idea of, okay, I'm in the hospital and I have a breathing tube, okay, how do I get my Parkinson meds with the breathing tube? If I don't get my Parkinson meds, this is going to be a double disaster. Things aren't going to work. I might not even breathe as normally. I might not be able to get off of this ventilator. Well, it turns out this problem is scalable. It's one that we've solved before COVID. And so if your doctors are struggling with this problem, there's an easy solution. It's usually a yellow tube called a Dobhoff tube. It's named after somebody named Dobhoff. Okay, so there's a tube, a yellow tube. You stick it into the nose, down the back of the throat, and it goes into the stomach. You make sure it goes in the stomach, and they take an X-ray, so it's in the stomach, okay, and not in your lungs. And then once it's in your stomach, you can crush up the meds and put it through this tube. Okay, so that's one way to get it. There are also some formulations of medications in some patients, but not all, that you can give by patch or by other formulations. And sometimes when there's partial swallowing, some of the dissolvable, or sometimes even with applesauce, depending on how safe we think that you are with your medical team, your doctors, your nurses, your speech therapists, and getting the speech therapists to come by if you get into the hospital to assess your swallowing and how they can get these medications into you is important. So being able to get the medicines to you, while you are in the hospital is important. They can also get them through a tube. So if you have a feeding tube, and feeding tubes don't have to be permanent, folks. So, I have a good friend that was just in a very bad accident here at the University of Florida in the middle of this COVID crisis, and she had to get a feeding tube, and she had to get a tracheostomy, and both have been removed now. So, so these things aren't always permanent, but there are things that we can do to both keep you alive and to keep you prospering. And so it's a great question. It's one that we commonly get about medications and making sure that that we're doing well. Now here's a question from Rumaitsa, and I apologize if I said that wrong, but Rumaitsa wants to know about his or her father is a patient for the past 8 years and having trouble with walking, but the main issue is that it seems like he gets a heavy head when he takes his medications, and some people do get this heaviness with their Parkinson medication, and sometimes we have this tendency as physicians and as nurses and as advanced practice providers, I'm guilty of this too. Like sometimes the answer is always more, more, more. But with dopamine, if you get to a certain level, sometimes you can get heaviness in the head and that feeling of heaviness and side effects when the dose is too high. So sometimes the dose has to come down, and then you can make the intervals between the medicines a little closer. So the timing is critical, and sometimes that heavy-headedness, you might want to talk to your doctor. I'm not telling you what to do. Remember, I don't do that. I'm like your cabinet advisor, but talk to your doctor or your advanced practice provider about whether the top end of that dose needs to be a little lower. Maybe the intervals need to change a little bit. Maybe that could help you, and possibly we add things like Lodocin. And Lodocin is when we have Sinemet, which Sin means without, emet means vomiting. So if you give it's carbidopa/levodopa. So we give the carbidopa to get it to the brain and to stop vomiting and to block that response, that nausea response. Sometimes the other way to get rid of heavy-headedness is to add more. You can put more carbidopa on there, sometimes sold under Lodocin. And then there's a medicine that's not available in the United States, but it's the most common anti-emetic that's available around the world. It's called domperidone, not the champagne, guys. Sorry about that. Not the champagne, but that is also another one that another trick that you can use. So thank you, Rumasaya, for that question, and I apologize if I got the pronunciation of your name wrong, but I certainly appreciate it. And here let's move on here. I'm seeing questions light up. So thank you for sending in questions and making this such an active forum here. Larry Kahn is asking a question about COVID-19 symptoms and what are the best chances. Larry wants to know about staying out of the hospital. I'm not sure where you're from here, Larry, but thank you for asking the question. And he mentions that Chris Como talks about fighting the virus, not letting it into your lungs, stretching exercises, supplements, drinking Gatorade. Can you confirm and explain? Great question. All right, awesome, Larry. Thank you for asking that. So here's the deal. we want to keep you in your homes as much as we can. So we want to monitor you. So if you have Parkinson, or if you don't have Parkinson, but let's talk about Parkinson, since we're a Parkinson foundation. If you have Parkinson, you're stuck at home, you're doing fine, then for whatever reason you get COVID. It's not your fault. Don't blame yourself. You got COVID, okay? We want to try to keep you in your house. First thing I want you to do is I want you to call your doctor. Okay, your doctor will be able to begin monitoring you. So all the patients I have with COVID, I call every day. Okay, we want to get you on a monitoring plan so we know what to do. We'll make a decision whether you need to be tested or not. Okay, and if so, where, and put that order into place. Okay, and then we'll monitor you each day and try to, based on your symptoms, make decisions to keep you in your home. Now, this question about what can you do, and this really nice advice that was given by Chris Como about fighting. Part of fighting is twofold, and he didn't say this in his interview, but I think I can infer this is something that he meant. I've seen a lot of Parkinson patients. I've seen a lot of people with diseases. And when you say to fight, I think when Chris Como is saying fight, he's also talking about demoralization. And in Parkinson's disease, demoralization affects 1 in 5 to 1 in 6 people. You can get demoralized faster and more frequently than people without Parkinson's disease, okay? And so demoralization is very common, and it's different than depression. And sometimes you can have both depression and demoralization. So one, you got to fight. You got to know that, you know, you can beat this. We've seen people with COVID and Parkinson, and we've seen them go all the way through and make it. Know that you can make it. So that's number one, is the demoralization. And then in terms of fighting, fluids. You know, he mentions fluids, and you mentioned fluids in your questions. Yes, Gatorade, water, pump fluids, get your pulse rate down. So the pulse can get up over 100. That's how many heartbeats per minute. You want to calm that down, and the way to bring that down is by hydrating yourself. You want to keep the fever down, so use Tylenol. If you're afraid to use ibuprofen, use another non-steroidal drug like naproxen sodium or something else. But use something to keep the fever down, okay, so you're not hallucinating, you're not confused. And then you do want to walk around some, not too much. Don't go outside now because it's high allergies. We don't want the pollen to get in the way, so we can't tell the difference between allergies and potential COVID symptoms. And so, but we do want you to stretch your arms, stretch your shoulders, you know, a lot, okay? You don't want you to make you so fatigued that you're trying to do too much. Don't try to do a lot of push-ups. Don't try to, you know, compete for the Olympics or do those things, because we definitely do not want you to fatigue yourself and make it harder for your body to recover. We are trying to keep you at home and put you in a position where your body can recover. And what Chris Como was saying was, if I can stretch my arms and legs, take some deep breaths, even if it hurts, get things moving, you know, in my chest, and I can, you know, move around a little bit. If you sit around, you're at more of risk for pneumonia. You'll clear secretions more. And so walking around the room some, doing some walking if you're not too fatigued. We don't want you to fall. If you have Parkinson, you should have help. Chris Como may not need help, but with Parkinson, we want to make sure, particularly with that hydration status, and you may have balance problems to start with. So hydrate. Supplements, you know, not, you know, nothing necessarily that we know of is going to help, but hydration, keeping that heart rate down, okay? So you're dehydrated when your heart rate's going up and when you're febrile, and keeping the fever down is important. Call your doctor, check in with your doctor every day, or your doctor's office or your advanced practice provider's office. Check in every day. Keep a plan, know when to pull the trigger, because it's not an automatic that the best thing for you to do is to leave your house and go out and go into an emergency room setting. That's not the automatic way to deal with this disease. And so Larry Kahn, thank you so much for the question. And I apologize for not getting to everyone's questions, although we got to quite a bit of the questions here. I'm going to end by clarifying one comment that we made about heavy-headedness. Somebody said when they take their medicines, they get heavy-headed. It's this weird subjective feeling that sometimes when you're on high dosages of dopamine, you take the pill, and it feels like you have a headache or a sinus or there's something in your head, and we get this heavy-headedness. And so talk to your doctor about dosages, talk to them about other anti-nauseas, carbidopa, domperidone. So we've come toward the end of the hour here. I want to say thank you for spending an hour with me today. This is going to be available on Facebook Live and then onto the YouTube channel. Thanks to John Lair, Leilani Pearl, Kathy Whitlock, Adolfo Diaz, and all of your great staff. Remember the 1-800-4PD-INFO hotline. Remember the Aware and Care kits. Okay, get your free kit. Call our group. We're here to help. Okay, we're here to help during this. And remember, when I tell you, in 1952 we were worried about the polio epidemic. We started with that reading. I just want to bring it home by saying how important it is with hospitalization, and with corona now, we have far eclipsed the numbers in 1952 of that polio epidemic. And so we're dealing with something very serious. We're very serious. We want to help you. There is a path forward here for you. We've seen people do really well. I personally seen Parkinson patients do well with this, so don't give up. Don't get demoralized. So fighting means two things. Don't get demoralized. Like Mr. Khan said, don't get demoralized, but also push fluids, get your pulse rate down, keep your fever down, and stretch out and take some deep breaths and make sure your lungs are functioning and you're moving around some, but don't fall and hurt yourself. So thank you again. It's a pleasure and an honor to be here with you from the Norman Fixel Studios at the University of Florida. This is a program brought to you by the Parkinson Foundation, and we're just so grateful that they're reaching out and helping. Look for us on the Facebook Live. Look for us on YouTube. Please call our numbers, 1-800-4PD-INFO. We're here to help. We're going to stay with you through the whole crisis. And remember, with Parkinson, we all want to take that pact for Parkinson: prevent, advocate, cure, and treat. So the Parkinson pact as we move forward. So it's been awesome being with all of you today, and have a great day.